Hi, I'm Dr. Jennifer Barna, breast imaging specialist at Central Maine Medical Center and director of breast imaging at the Bennett Breast Care Center in Lewiston. I'd like to talk with you for a couple minutes about 3D mammograms, also known as tomosynthesis. I'd like to explain what a 3D mammogram is and how it differs from a 2D mammogram, the kind you've been having unless you've already switched to yearly screening 3D mammograms. After I explain the difference between these, I hope it'll make sense why 3D mammograms help us to find more cancers, allowing us to find cancers that may have been hidden on 2D or digital mammograms. As you know, a mammogram is a breast-specific X-ray that allows doctors to look for breast cancer. Before I explain how 3D mammograms work, I'd like to take a step back and briefly talk about types of breast tissue and then explain how 2D or digital mammograms work. Knowing this will make it easy to understand the difference between 3D and 2D mammograms. In your breast, you have different types of normal tissue. There's some tissue called fibroglandular tissue, which shows up as white on a mammogram, and there's some fatty tissue that shows up as dark on a mammogram. Every breast is different and has its own mix of fibroglandular tissue and fatty tissue. If your breast has a lot of fibroglandular tissue, it'll show up as a lot of white on the mammogram, and we call that dense. If your breast has mostly fatty tissue, it'll show up as mostly dark on a mammogram. The purpose of the mammogram, of course, is to look for cancer. So how does cancer look on a mammogram? Well, cancer usually appears white, similar in color to normal fibroglandular tissue. I'm simplifying this, but basically the way we can tell cancer from normal tissue is by looking at the borders or edges of any spot that catches our eye on the mammogram. And also we look for changes compared to your prior mammograms. Borders or edges are important for us to look at because cancers usually have irregular or spiculated edges, whereas normal tissue does not. The problem is the edges of a cancer can be hidden. And in order to understand how that happens, let's talk about how a 2D mammogram works. For a 2D mammogram, we compress the breast one way and take a picture from the top. And then we compress the breast another way and take a picture from the side. So a 2D digital mammogram is two pictures of each breast, one from the top and one from the side. As we already know, the breast has a mix of fibroglandular and fatty tissue. The fibroglandular tissue shows up as white on a mammogram, and cancer also usually shows up as white on a mammogram. This can make finding cancers a challenge. Let me explain it this way. Imagine this book is like a breast, and the pages are like compressed breast tissue during a mammogram. Now, there are a lot of words in this book, just like there's a lot of tissue in your breast. If you imagine that an X-ray could take a picture of this book from the top and it could see through the book so that all of the words in the book would be on that picture, you can imagine that there would be a lot of overlapping words because the pages of the book all overlap each other and there are words on every page. Let's then imagine that you're the doctor looking at this picture with all of the overlapping words from this book, and there's only one word you're trying to find: cancer. The word might be in the book or it might not. Hopefully not. But if it is, you need to find it. On that one picture, it would be very hard to see the word you're looking for. There are just so many overlapping words. Maybe you could see part of the word. Perhaps you could just see CA and the rest of the word is blocked out by other overlapping words. You can't tell if the word is cancer or some other word that starts with CA. What would you do? You'd call that book back for extra views. So you get the idea. A 2D or digital mammogram takes two views of each breast, and there can be a lot of overlapping fibroglandular tissue on those views that can hide a cancer. So how does a 3D mammogram work, and what's the difference? Well, from your perspective as a patient having the test, you'd hardly notice a difference. You still get compressed from the same two ways, from the top and from side to side for each breast. But what happens is when the 3D machine takes the pictures, it moves in an arc over the breast, and in just under 4 seconds it takes 15 low-dose pictures of the breast from the top and then from the side. The machine is then able to reconstruct those pictures into multiple stacked 1 millimeter layers of the breast, like pages of a book. So with a 3D mammogram, it's as if we can open the book and look through page by page, instead of taking one picture from the top or from the side. You can imagine that looking through the book page by page, if a bad word, in this case cancer, is there, we're more likely to be able to see it than if we look at the book with a picture above that has all of the pages overlapping. Seeing the breast in layers like this takes away a lot of the normal overlapping structures, making it more likely that we can see the borders of a cancer. Interestingly, not only does 3D mammography allow us to see more breast cancers, very importantly, it allows us to find more invasive breast cancers. So it helps us find the cancers that are more likely to be dangerous. And it's just as good at finding the non-invasive cancers as digital mammograms. It also stands to reason that since we can see the layers of the breast without so much overlap, we don't have to call as many people back for extra views. Okay, so that's how 3D mammograms work. I'm sure you know that mammograms are not perfect. Breast tissue can be complex. There are things that are not cancer that can be there, and some of those look similar to or even just like cancer on a mammogram. The doctor has to try to sort out what's not cancer from what is cancer. So some people still do get called back in order for us to take a closer look. If you get called back, we may need to do extra mammogram pictures and/or other studies such as breast ultrasound. If we can see from the extra views there's nothing to worry about, we'll let you know that, and you'll be able to come back for your yearly 3D mammogram next year. A few people will need a biopsy to determine if something is a cancer or not. But if you have yearly 3D screening mammograms, you'll have a lower chance of getting called back for extra pictures for something that is not cancer. And if you have a cancer, with 3D mammography, our ability to see it is better. And when we find it, it will likely be smaller and more likely curable. Research has shown that there's a benefit to having 3D mammography for patients with all types of breast tissue. In summary, a 3D mammogram allows doctors to see cancers more clearly, so there's less chance that a cancer can hide. And also, there's a lower chance that you'll be called back for something that turns out not to be a cancer.